Hello everyone, it's Dr. Aaron Van Gaver, naturopathic physician working in downtown Vancouver, and coming to you to actually educate you a little bit about what it is that I do. Typically my episodes are about a specific health complaint, and I educate you guys on a few tips with that, but it's coming to the end of the year and people have been reaching out asking me about their extended health benefits and whether or not it would be worthwhile to come see me, and I realize that not a lot of people know what it is to see a naturopathic doctor. So if you've been wondering what it is to see a naturopath or a naturopathic doctor, this is what today's episode's about. Okay, so do any of you guys actually have extended health benefits? If you do, you should look to see if you've got a line item that says naturopath. Other names that you may see is naturopathic physician and naturopathic doctor. We are a regulated health profession here in British Columbia. We're regulated in over half the provinces here in Canada. And what that means is that we're regulated under the same laws as other health professionals like medical doctors and dentists. It's a level of protection that the public has in naturopathic doctors. So being part of a health college means that if there's a complaint made against me, there's an investigation process and there's a way of actually ensuring that there's safety for public. I get asked all the time, you know, are you a homeopath? And I'm not a homeopath. So homeopathy is something completely different than what naturopathy is. There are some naturopathic doctors that do utilize homeopathy as a treatment tool, and I don't want to get too much into what homeopathy is. Maybe that's going to be another episode. But I would say a majority of naturopathic doctors' main practice is not in homeopathy. There's a few similar philosophies that naturopathic doctors have with medical doctors. And there's some similar type trainings that we have. So we believe in doing no harm to our patients. In order to become a naturopathic doctor and a medical doctor, you need to have a university degree to get into it, so a bachelor's degree. After that, it's a 4-year medical program. And one of the deficiencies that we have in the naturopathic profession, and that's really because we're kind of a newer profession, is that we don't have a lot of residencies. So whereas in the medical field, you graduate from med school, you enter a 3 to 7 year residency program where you get to learn under someone and hone in your skills and focus in your practice. There are few naturopathic residencies out there. If they're out there, they're usually in the oncology or the cancer world or generalist practice. So you graduate from your 8 years of education and you become a naturopathic doctor. Every naturopathic doctor has a different way of practicing. We all follow similar tenets, which is trying to treat the whole person. So one big glaring difference that you would see by going to see a naturopathic doctor is that you're going to get an hour with me on the first visit. We're going to sit down and really going to talk about your family history, talk about where you're at in life, look at your diet, talk about any medications or supplements that you're on. If you've had any blood work or imaging studies recently, we'll take a look at that. Really, for the most part, you won't actually know that there's a difference between seeing me and a medical doctor, except you're going to be sitting there for over 15 minutes and you're going to be going, hey, what's going on? You're not kicking me out of your office room. And so that's a deficiency that the medical world has. They don't always get the time that they probably would really want to spend with patients. Because we are a private fee service, we have the ability to spend more time with patients. We do the same types of physical exams. We run the same types of tests. We just, unfortunately, don't get to access the provincial health system on that. I've been called other things from quack doctor to witch doctor. I would say I'm pretty evidence-based. The naturopathic profession is an evidence-based profession. First and foremost, we're looking at treating the underlying cause. We're looking at trying to get at the root of what's going on with someone, and I think you guys could understand that's a pretty important thing. So instead of necessarily, giving cough medicines and cold medications to suppress symptoms, we're trying to look at those symptoms and saying, hey, that's a symptom that the body is telling us something. Let's try to figure out what it's trying to say and why it's trying to say that. Chronic conditions, IBS and Crohn's. We're trying to figure out what could be the cause of that. Is it an autoimmune condition? Is it due to food sensitivities? Is it a hormonal imbalance? Is it a bacterial overgrowth? And so I think the real cool thing I get to do is sit down and really get to know my patients. Now, we try to treat the whole person. We try to support the body's own natural healing ability. If there are obstacles to whatever a person's path is. We try to help remove those obstacles. We have a few tools that are common to most naturopathic doctors, and that's the use of botanical medicine. So we have 4 years of botanical medicine training. A lot of naturopathic doctors are dually trained in acupuncture, lifestyle counseling. So I have additional counseling training, especially focused in the addiction area. We've got nutritional based stuff, so learning about vitamins and minerals and amino acids. A lot of naturopathic doctors perform chiropractic type manipulations. We call them naturopathic manipulations, but they're the same types of, cracking the back and adjusting the neck. It isn't something that I do a lot of in my practice. I would say my modalities that I focus in on are nutritional, herbal, counseling-based stuff. And I use acupuncture and IV therapies, so I do a lot of IV vitamins and amino acids with that. So, we have probably just over 2,000 naturopathic doctors in Canada. Some of you may have seen the national campaign that we have going on right now. And this national campaign is to hopefully help educate people and to realize that naturopathic doctors are actually scientific. There's lots of research into anything that we do. If we do prescribe medications, because I can prescribe prescriptions, we want to make sure that they're done at the lowest dosage possible to have that effect, and we work really hard to minimize the side effects. So if we do prescribe an antibiotic, for example, we're going to make sure that you're taking a probiotic and you're doing things to help prevent that from actually creating a dysbiosis or a change in your equilibrium in your body. When it comes down at the end of the day, naturopathic doctors really have the ability to look at where you're at and help you get to any goal that you may need. We also have the ability of forecasting any preventative-based stuff that you may need. So we look at cancer risk in the family, heart disease, and diabetes, and we can take a look at where you're currently at from a health perspective, looking at your blood work, and really plot a risk assessment as to whether or not you're going to develop heart disease, stroke, cancer in the future, and then look at strategies to help mitigate or reduce that chance. I think once a year I see most of my patients. Sometimes I don't see them for a few years, and that tells me they're usually doing a lot better. Just like you go to a dentist once or twice a year, going to a naturopathic doctor can just make sure that you're keeping yourself on track. Are you drinking enough water? Are you pooping and peeing every day? If you're constipated, that's a problem. Are you smoking cigarettes? Are you drinking too much alcohol? Are you into some recreational drugs and you're having a hard time stopping? Those are all things that I can help people with. If you've got extended health benefits, it actually helps to know that your work is supporting alternative or integrative type therapies. So what to expect in your first visit. So, if you're interested in coming out to see a naturopathic doctor, you go to their website. And of course, if you're across Canada seeing this, you can go to mynd.ca, which is a website where you can actually find naturopathic doctors in your area. But my first visits are usually an hour long. You bring in your diet journal, you bring in your medications, your supplements, any lab work that you've got, and we sit down and we have just a real great chat. It's about you getting to know me and me getting to know you. And then in that first meeting, I'll write down some homework and some ideas of things that we need to try. Usually at that point, if you haven't come in with your diet journal or any labs, I'll get you to go and do that. And then usually within a week or two, I get you in for a second visit, which I do a physical exam. So I'll listen to your heart, listen to your lungs, anything that's really specific to your complaint. And we take a look at any homework that we've given, and then we put a protocol together. And I let you go. And then usually a month later, we meet again to see how that works. Now, the main types of areas that I work in, I do a lot of hormones, so adrenals and thyroid and menopause and dysmenorrhea, changes in your periods. I do a lot of allergies, both food and seasonal. I do heavy metal-based stuff, so if you've got heavy metal buildup in your body. I do a lot of mental, emotional, addiction-based stuff. And of course, GI. Can't not work on the GI system when it comes to seeing a naturopathic doctor. So I am practicing downtown Vancouver. I am always open to answering questions. I really hope that these Facebook Live posts are going to be interactive and people feel comfortable asking questions, because I'm happy to answer them. If you have any questions, send me a message on Facebook. Happy to answer them. You can also find me on YouTube, on Google+. You can find me on Twitter. You can find me on LinkedIn. You can find me a lot of places. And all the contacts are actually through my Facebook page, so you can actually find those. Okay, guys, it is Friday. I'm working tomorrow, but hopefully you guys have your weekend off. We're getting close to the holidays. I'll be doing one last one next Friday. That will be Christmas Eve. Be pretty exciting. As you can see, I do have my Christmas lights up here. I've been indulging in a lot of baked goods. My partner's father baked some amazing type treats, and I've been kind of sneaking into them. They're pretty good, but I'm pacing myself. So everyone, I will chat with you in a week. Be safe, and we'll talk to you soon. Dr. Aaron, out.